Do I start?
हेलो हेलो सराहना करना था सर स्टार्ट कर देते हैं हाँ ओके बोलो ओके
Good afternoon. My name is Dr. Nagaraj Gururaj Goilgol. I'm a Chief Radiation Oncology at Nanavati Hospital, Mumbai. It is located in Villepala West. I've been associated with Cancer Aid Research Foundation, which has a popular acronym called CAF. My association starts way back. I think it was at the very beginning when Rehan was here, came back from England, and we had some wonderful association. I recall him giving a book he edited or wrote on head and neck cancer. Thank you, Rehan, and it was wonderful seeing you the other day on the monitor of this as a part of the first lecture, and it gives me an immense pleasure to talk talk to all of you. Well, what has beset or what is bothering all of us is a small little tiny speck of protein called coronavirus or COVID-19. It has created a lot of fear. It has, of course, there is an endemic or a pandemic, as we say, which means a lot of almost all the countries in the world, except barring a few, are affected by it. And all of us went into lockdown. We hunkered down. We were isolated. As a result of which, even the patients with cancer refuse to come out or were not allowed to come out. There are a lot of uncertainties as to whether um, we should be we should be taking treatment, we should not be taking treatment. There are a lot of questions that come about, not only about the virus, but uh, also about treatment that one has to take. So now what I intend to do today in the next 10 minutes is to tell you what this virus is all about, then tell you what is radiation therapy all about, and can we take radiation or any other treatment for cancer, or we should rather be at home totally scared, needlessly scared about this particular infection called coronavirus. So now let us start from the very beginning. And as we see in the first picture itself, radiotherapy in the times of COVID-19 pandemic, you can see that this used to be a buzzing place and there is just nobody. Everybody just hunkered down in as if there's a war. And I don't like this phrase called war against pandemic. No, we're not fighting a war. We are coping, we are managing, and the war creates a needless fear, and let's not get into that. Now, these viruses are very small particles. Since it's submicron, you cannot see with your naked eyes, and that's the problem. If you saw with them with naked eyes, probably could just eliminate them. So these are submicroscopic particles. There could be a single strand protein, single strand RNA or double strand DNAs. That is, you have a couple of varieties of viruses which affect human beings. Now, let us understand that this viral infection or viral disease is not something new. We have been having this. And it's very common that many times, probably, if some employee of yours wanted to skip work, he would have said, "मुझे viral हुआ था." And it's just an odd fever and a body ache, and he would self-diagnose and viral, and it just would go away. Right. So what the virus initially meant poison in Latin, and it's used as something which is from outside our body, which comes in and affects us, or its medical use started something in 1728. The idea of virus is as old as that. It did not happen yesterday. There are viruses and viruses, and it's also felt that virus has been very important to the evolution of human being, or evolution of life at large. And there are viruses and viruses. Not all viruses are bad. Not all viruses have the same aggressiveness or not all viruses kill. Uh, The best example here is, say, for instance, Ebola virus or Nipah virus. Probably some of you might have heard of Nipah virus because um, the Kerala managed it very well. I think it was last year, a year before that. And when somebody got infected with Nipah virus, 70 to 80% of them would die. And of course, as I spoke to you about common flu, yeah, and that's just a good excuse very often for an employee to take vacation. So common flu doesn't really kill anybody, maybe a little inconvenience. Ebola does, so we have different kinds of virus. Now let's look at what coronavirus does. Now we have again the idea of this species of coronavirus uh, was seen in 1960. There are alpha, beta, gamma, and the other four varieties, and the variety that concerns us today is SARS-CoV or COVID-19. It has been renamed by WHO as COVID-19. It belongs to a family of corona viruses. It is called corona because when you look at the virus, it looks like a crown. It's circular spikes and it looks like a crown. I will go. So what does it do? When it infects, generally it infects upper respiratory tract. So you have a dry cough, fever, sore throat, headache, fatigue, body ache, diarrhea, runny or stuffy nose, shortness of breath, or sometimes depression. Because when you have all of this, these are non-specific symptoms. I'm sure you must have seen it in many other illnesses, or even influenza. So, as there used to be a very popular cartoon, not every cough is corona. Yes, indeed. So, just because if you get any of these symptoms or any combinations of this, don't panic. Okay, go to a doctor. They will see as to whether it's really it's due to coronavirus or something else. So if it was just this, probably there was not much of a problem. Some of this can lead to heart problems and lung problems. So this is called ARDS, acute respiratory distress syndrome. When a person infected with coronavirus goes into ARDS and he has also heart problems or multi organ failure, then the problem sets in. However, let's understand that that proportion of people who undergo this is a very small one, and this shows the mortality in various states. It also, I think, if you look at it, Kerala has done very well. Uttar Pradesh has not done so well. Madhya Pradesh has not done so well. Gujarat has not done so well. It also perhaps reflects not just the coronavirus infection, but also preparedness, the competence, and the hospital infrastructure available in those states. So, in brief, what I need to tell you, or what I'm trying to emphasize is, we have seen this before. Viral epidemics, we have seen this before. This is one in the great influenza virus or Spanish flu virus that's nearly a century back, and nothing much has changed. Nothing much has changed in the sense one thing, of course, has changed. We know much, much, much more, and we know what to do when we have these viral epidemics or pandemics. One of that is very, very important. And if you're infected or if you think you're infected, all that you've got to do is wear a mask like this. All right. And this is the picture that you see there. It helped them and it will definitely help you today as well to prevent the spread and to prevent having it yourself. So, in brief, when uh, when we have a coronavirus illness, we have various symptoms which are not specific to it. But when somebody gets what we call an ARDS or viral pneumonia, you have these changes that you see in an X-ray. One smart thing has happened, and that is these X-rays now you have computerized artificial intelligence based assessing systems So which means we can do a mass screening as well if necessary. Of course, it's not being done now. RT-PCR, the important screening test, is the one which goes for testing. This is how the progression of lung problem or the pneumonia can set in. And let me tell you, I've seen patients even from here, especially the young ones and even the middle-aged ones. I've seen patients coming back out of not even ICU, but just maybe an oxygenator and going back and doing well. So corona is for real, but it's, I think the fear is much more. The mortality is not very high. It's there, but not very high, and it is especially more in old people with comorbid conditions like diabetes, hypertension, and so on and so forth. A fellow who is 60 but looking like 80, I'm sure, has a much higher probability of dying or getting infected than 80 looking like this 60. All this information is very important because I see that every society, every person has suddenly become an expert in this virus epidemic and making their own rules and understanding. Don't fear, first of all. Okay? So, why am I saying this? I have seen a lot of patients, my patients, who were prevented from coming for further treatment. They had cancer. Some patients thought that because I have cancer and there is a COVID epidemic, I'm more susceptible, so I would rather die of cancer than coronavirus. All these myths are wrong. All these misconceptions are wrong. I mean, misconceptions should not be there. All right. So now we have understood what corona is and why we should not be really worried and scared out of our wits. So now let's understand what is radiotherapy. Radiation therapy is an extremely important part of cancer management. We have surgery like Dr. Rehan Kazi does, radiation oncology, medical oncology, where you give chemotherapy, your immunotherapy, your targeted therapies, your hypothermia, and so many of them. And let's also understand that the treatment of cancer, and especially in certain types of cancer, it can be potentially curable. And just because one is scared of corona, and if they prevent or if they don't go for treatment or they postpone the treatment, they might lose their best opportunity. The first opportunity where it was potentially curable now suddenly becomes incurable or becomes advanced. So let not this fear prevent us from seeking the best treatment. So the best way to do it is to also understand what radiotherapy does and what is the evidence to which about for which what I'm saying. I'm saying that don't worry about radiotherapy or other treatment. It will not harm you, but it will help you. Even in spite of COVID, is there any evidence? Yes, we'll come to it later. All right. So what does radiation do? Radiation is like X-ray. When you get the CT scan or the chest X-ray that I showed you, these are some of the kinds of X-rays, but they're more powerful. When they go inside the body, they interact with these tiny, tiny cells, and they what they do is this protein like the RNAs and the DNA that I mentioned, especially the DNAs, they break them. Okay, they break them. They're called single strand breaks and double strand breaks, and that's it's all very technical. Also, they sometimes damage the cell membrane, and each cell has a membrane. All right, the viruses don't have that kind of a membrane, but just the covering. So that cell membrane also get affected, and with a lot of cellular and intracellular oxidative stress happens, as a result of which cancer cells die. Now, what happens with the normal cells? Some of them may get injured, but they're robust, very, very healthy. So they get repaired, and bingo, do we have differential. The bad cells die, and the good cells come back to health, and the bad cells then eventually get cleared. The bad cells eventually get cleared. All right. So now, how do we do it? We have various machines. In our hospital, we have what we call as a where we have two accelerators. One is a health center. The very recent acquisition is a highly targeted, image guided, volumetric. In this, just 2 minutes or 3 minutes, it's very functional. very ergonomically designed. And we also have an earlier, this Halcyon is by Varian company, an American company, and another accelerator, which has very high energy and electrons. It is from Electra. So we have two machines. Why am I emphasizing this is now uh, because we have two machines. Even though we have a lot of patients, uh, we can space them without compromising with keeping in mind the social distancing that we need to, and we also allow a reasonable number of patients because we have two machines, we have plenty of time, and they're very spacious. These small little things must be kept in mind when we are seeking the treatment or when we are getting treatment. Coronavirus is for real. So one of the uh, way we can prevent, as I said, is wearing a mask. I showed you the mask, and that was done even earlier. Additionally, what we have realized is sanitizing the surfaces and sanitizing our own hands, our personal hygiene, and social distancing is supposed to make a lot of difference. And that's very important when you choose your place and then when you go for the treatment. So, as I said, radiotherapy forms a very important part of the treatment of cancer. And if it's a potentially curable disease like a vocal cord, cervical cancer, breast cancer, so on and so forth, it's very useful. We should not be postponing them. And we'll come to that for triaging as to how we should go about it. So we understood that various machines that are called accelerators, it could be early telecom, if they need to be sanitized, they should be social distancing, and if we follow the proper precautions that is necessary as per the guidelines, the chances that one can get corona during the treatment is not really there or hardly there. This is what we call as a brachytherapy. Here is a little tricky stuff. What I was calling it, what I showed you was external brachytherapy. This is what we call as a brachytherapy, wherein we'll have to do a procedure to put these isotopes inside. All right. This is for the head and neck, tongue tumor, and another one is for prostate. One above is for the this one is for the tongue. Now, this oral, many of the surgeons, many of the radiation oncologists would be real wary of doing these invasive procedures in tongue because corona inhabits oral cavity, pharynx, and lower, lung, and the rest of that. So people or even the doctors would be a little wary. So what does one do? There are alternatives. An alternative is, of course, what we call as the intensity modulated radiotherapy, and I showed you the machines earlier. So we have a solution for all of this, and but I said brachytherapy may be tricky, but still can be practiced. Right. Now, how do we give radiation? We give radiation on an everyday basis. It could be once a day, 5 days a week for 6 weeks, 7 weeks, or something like that. And that's called a very conventional way of doing it. There are various kinds of giving it: hypofractionation, accelerated fractionation, stereotactic radiosurgery, stereotactic body radiotherapy, SBRT, so on and so forth. So what does that mean? It means that you can adjust the timings. So when can we give? What are the types of radiotherapy you got to give? Radical radiotherapy, preoperative, postoperative, palliative. That means radiotherapy is not only for cure, but also before surgery, after surgery, or to make the symptoms better. Now, as I said, we got to prioritize radiotherapy because sometimes, especially in a overcrowded radiotherapy department, if there's a patient wherein you can now or never, that's an emergency. Somebody is bleeding, you've got to give a hemostatic radiotherapy. Somebody has SVC syndrome, you've got to give now or never, or the patient will never come back. You've got to start the planning there and then itself. Palliative, it may not be curative, but if patient is in distress, give a priority. And patients potentially cure. If you don't give them now, they will come back later with a very advanced stage and they would have lost the best chance to get better. And the fear of corona would have really deprive them of cure. And there are some situations, a small number of patients, where you can delay them by 2 3 weeks. You should postpone them. So there are tier one, tier two, tier three recommendation by ESMO, that's European Society. There is almost everybody who has their own recommendations. What I told you just now, as to now or never to various potentially curable, so on and so forth, is what it says. I told you about ISMO, etc., because everybody is thinking as to how we should handle this pandemic. These are some of the ways of doing it. Old age, advanced diseases, comorbid conditions, as I said it at the very beginning, may be a little dicey, but don't worry. One has to be aware of them when we are managing, and then manipulate in such a plan in such a fashion that in spite of these comorbidities, your toxicity is not very high, your approach is different, so on and so forth. First of all, do not fear COVID. Good hygiene, etiquette for interpersonal interactions, and environmental hygiene is very necessary, and we'll see through this pandemic. And and how do we see through this pandemic? Not just avoiding and sitting at home. And if one has a cancer, they will come back and to the hospital right away, and they take the treatment. And doctors will have prioritize your treatment schedules, but you will get your treatment. You will not lose out on better outcomes or the outcomes the way they should be. They should be just because there's a COVID. Okay, there are some evidences. These are hard statistics. How many minutes more? Another 2 3 minutes.
In fact.
Another 5 minutes. Oh, that's plenty of time. So there are certain studies. Which, I'm not just whatever I've said is based on studies that is available. It's not just my personal opinion. Uh, okay, and of course, it's very surprising. In the last 2 months, I've not seen a single patient with cancer with COVID. That means the association between cancer and COVID is not so common. What is, however, very common is fear of cancer, a fear of COVID in patients of cancer is much more common than the infection itself. Okay, so am I talking on the basis of some hard data? Yes, some data has emerged. Of course, it's a very short time, 2 months and 3 months. That's about all. Uh, Various organizations across the world are trying to address this problem on a very objective, on the scientific basis. This is one of the very recent study, and especially even personally, I'm very careful when I treat head and neck cancer like Rehan does, Dr. Rehan does, or lung cancers. I'm very careful. So this is a study reported by from 422 thoracic malignancies, that is cancer of the chest. And this was collected from 26 countries because, as I said, it's not very common to have coronavirus and the cancer. So you've got to have everybody pulling in the data. Science is universal. Science is for everybody. So we have, if we look at all of this data, we see that, say for instance here, 79% of for due to COVID, 10%, 10.6 due to cancer or both unknown disease. This is majority of patients had lung cancer. And when we're trying to monitor various sites and from various groups, what we have realized is that there's no evidence to suggest that cancer patients on cytotoxic chemotherapy, remember that, or other anti-cancer treatment are at an increased risk of mortality. This is at Lancet 2020 May research. Contrary to assumption that anti-cancer treatment may increase mortality. This holds true for radiotherapy. This holds true for elective surgery. Patients with cancer and on anti-cancer treatment of cancer have a high risk of COVID. However, the evidence is case and retrospective. Some people think that patients with cancer, because of their immune suppression states, is has believed that they're at a higher risk of contracting COVID, but this is a retrospective analysis. It's more anecdotal, and the evidence is sparse. I personally think that I don't think that they are really at a higher risk of contracting cancer, and I think there's a lot of evidence to say what I'm saying. This is a conclusion taken together with earlier reports of COVID-19. Patients with cancer appear to be at a higher risk of mortality, illness regardless whether they are on cancer or both. Can, if you have cancer, don't be worried. Come for the treatment, go for the treatment, and do all the right things of isolating yourself, so on and so forth. There are various ways of prioritizing. Don't be scared of coronavirus. Radiotherapy is an effective treatment. So is chemotherapy. There's no evidence that these treatments can adversely affect the outcome. There's a marginal fear, not based on a very good evidence, that cancer patients are a little more susceptible. I think the comorbid conditions are associated conditions. Old age and diabetes is far more important. Dr. Rehan Kazi, it was wonderful talking to you seeing you the other day. Thank you, Tabusun. Thank you, Sejan, for putting these slides together and uh, uh, giving me this opportunity. And I must be failing in my duty if I do not acknowledge Cancer Aid and Research Foundation. They have been my association with them has been long, since very long, perhaps from the very beginning, and they have been always good to not only to me but for my patients as well. And next in the series is by Dr. Sri Sharani. Okay, she's a pediatrician trained in the UK. Her talk for 10 minutes is on June 17th at the same time, that's 12 noon. Topic will be on children facing practical problems and in the times of COVID, right? There must be, I'm sure many of you must have seen many cartoons where children are happy because there is no examination, but it's far more serious when it comes to children. So thank you very much for all of you to have heard me middle of the afternoon. If you have any questions, I'll be more than happy to answer them.
Question असते.
No, there are no questions. Any questions? I don't see any of them here. Okay, I have one here. Okay, my friend is having a oral cancer. Doctor and suggested radiation. Can it be helpful? Yes, it's absolutely helpful. Uh, as I told you, there's no robust evidence that if you give radiotherapy for any of these patients, uh, there's any problem or it's compromised. Sometimes some medical oncologists or some radiation oncologists may hesitate to add chemotherapy along with that. That's the only thing. But there are other options like targeted therapies and so on and so forth, or hypothermia in my department. Please do not postpone your treatment for the fear of coronavirus, unless there are other reasons like extreme old age, debilitating situation, so on and so forth, but not otherwise. Yes, you must go for the treatment. My friend is having breast cancer. Doctor had suggested radiation therapy, but she's having fever, with cough and cold. We go for radiation. Wait for it. Yeah, this is from Akshata Sound. Akshata, I think wait for a day or two. There's no harm in doing it, especially the breast cancer can wait. If the cold and cough and the fever persists, go and see your doctor, and if necessary, get one COVID done, one or two COVID negative tests. And this delay in a week will not is not going to compromise her outcome. So maybe she can wait. And then here we have Felix Rodriguez. Sir, for recovered cancer patients, can COVID affect them easily? Now, as I said, there's no evidence, first of all, that cancer patients are more prone for that. So, a recovered patient of cancer is even better. And it also depends how long since the previous treatment was given, and what is the interval between the recovery and now. All right. So in the say for instance in the immediate post-operative post chemotherapy situation, there will be slightly immune compromise. One has to be a little more careful of social distancing. Don't go in a public poorly ventilated public place. On a beach is fine, but especially if you want to go and once it is open, want to go and shop in a mall, be careful. Wait for a while. Wait for a month or two more, and things should settle down. Avinash Trivedi, very informative. Thank you so much, Avinash. Uh, Anuradha, hey, Anuradha, very nice talk. Thank you. Thank you so much. And any other questions? I don't see any more questions. Again, I repeat, don't be scared, don't be worried. We're going to get over it. The pandemic of fear is affecting us far more than the coronavirus. In fact, the mortality should not be more than 1%. It should be eventually like influenza. Maybe eventually it will be a next reason to miss a very hectic work schedule in their office. Nothing more. Cancer more often can be treated effectively and it can be triaged. Like in breast cancer, that lady was asking, can be postponed if there are problems like fever and so on and so forth. Well, a little common sense, good personal hygiene, good interpersonal etiquette is all that is required. With cancer, without cancer. What is your opinion on outcomes of new hyper? Well, Gopal, there is a robust evidence for hyperfractionated radiotherapy in most of the sites, like especially like prostate cancers, now the pancreatic cancer, lung cancer, very early lung cancer. So it is not hyperfractionation is not new. In fact, my first paper was on hyperfractionation 30, 40 years back. There is much more robust evidence with the modern machines, like I showed you. Hyperfractionation in selected sites is exceedingly useful. It's not something that we have come up to deal with corona, but it has been already there. It can be easily and very scientifically integrated into the current management of cancer. Thank you, Anand. Thank you, Jyoti, Felix. Any other questions? Yeah, I think it's the end of the live video. Is that right? Thank you, all of you, for being here and listening to me. And I hope it was useful. And I thank you, Rayan. Thank you, Tavisum, Sejal, and Karf at the end of it. They are much more important. Thank you so much.
मस्त सर बोलला. हे काय केलं सर? सगळा चेहरा काळा दिसत होता. हे कुणी केलं?
माहिती नाही कोणी